Health history and physical examination. A registered nurse with the necessary knowledge, skills, and ability may collect information pertaining to a patient's health history and perform a physical examination. When performing a history and physical examination, a registered nurse should timely report to and consult with other members of the healthcare team and make referrals as necessary. A registered nurse who is not an advanced practice nurse in collecting a patient's history and performing a physical examination shall not form a medical diagnosis. Obtaining a patient's health history and performing a physical examination are activities completed by the nurse during the assessment phase of the nursing process. Assessment is identified as the first step of the nursing process. The information obtained during this phase contributes to a database that identifies the patient's current and past health state and provides a baseline against which future changes can be evaluated. The purpose of the nursing assessment is to enable the nurse to make a judgment about the patient's health state. However, it is performed continuously throughout the nursing process to validate diagnosis, evaluate the patient's response to nursing interventions, and determine the extent to which patient outcomes and goals have been met. A medical history is a standard format designed to collect data to be used primarily by the physician to determine risk for disease and diagnose a medical condition. The physician's physical examination and laboratory and diagnostic tests assist in establishing a medical diagnosis and evaluating specific medical therapy. The information collected and reported by the physician is also used by the nurses and other healthcare providers, but within the focus of their care. An example would be a patient has an abnormal results of a neurological examination by a physician due to a brain lesion. The nurse may use these same results to identify a nursing diagnosis of risk for falls. The physical therapist may also use the results to plan therapy involving exercise, splints, or ambulatory aids. The health perception health management pattern includes information about the patient's ideas about risk factors. This includes healthcare behaviors such as health promotion and illness prevention activities, medical treatments, and follow-up care. Nutritional Metabolic includes daily consumption of food and fluids, favorite foods, use of dietary supplements, skin lesions and ability to heal, condition of the skin, height, weight, temperature. A general survey can describe the patient's general nutritional status. Elimination patterns describe the regulation, control, and removal of byproducts and waste in the body, patterns of bowel and urinary excretion, perceived regularity or irregularity of elimination, use of laxative and changes in time, modes, quality, or quantity of excretions. Activity looks at patterns of patient's exercise, activity, leisure, and recreation. ADLs, which require energy expenditure and factors that interfere with the desired pattern, such as illness or injury. Sleep rest pattern. Now, this is a pattern of sleep and rest or relaxation in a 24-hour period. Also includes perception of quality and quantity of sleep, rest, and use of sleep aids. Cognitive. Perceptual is adequacy of vision, hearing tests, touch, smell, pain perception, and management. Language, judgment, memory, and decisions. Self-perception, self-concept, is feelings about self and the hospitalization are assessed in the self-perception, self-concept pattern. This can also be perceived abilities, worth, self-image, and emotions, body posture and movement, eye contact, voice, and speech patterns. The role relationship patterns is perception of major roles, relationships, and responsibilities in current situation. Satisfaction with or disturbance in roles and relationships. Sexuality and reproductive pattern. Satisfaction with sexuality or sexual relationships. The reproductive pattern. Female menstrual and perimenopausal history. The coping stress tolerance pattern includes information about other major stressors confronting the patient. Capacity to resist challenges to self-integrity. Methods of handling the stress. Support systems in place. Perceived ability to control and manage situations. The value belief patterns. The values, goals, or beliefs, including spirituality, that guide choices or decisions. Perceived conflicts in values, beliefs, or expectations that are health-related. Inspection is the first of the major techniques used in the physical examination. Performing a physical examination of the chest using inspection, palpation, percussion, and auscultation to determine respiratory status and differentiate primary lung problems from cardiac problems. When assessing the abdomen, auscultation is done before palpation or percussion because palpation and percussion can cause changes in the bowel sounds and alter the findings. A comprehensive assessment is a detailed health history and physical examination. Comprehensive and focused assessments may be needed after the patient is stabilized. The focused assessment is needed when a patient has clinical manifestations that indicate a problem. The screening examination or assessment is used to assess for possible problems such as colorectal cancer in patients who are age 50 or older. An emergency assessment is done when the nurse needs to obtain information about life-threatening problems quickly while simultaneously taking action to maintain vital function. The nurse may need to ask only the most pertinent questions on a specific problem and obtain more information later. A complete health history will include subjective information that is not available in the healthcare provider's medical history. Family members may be able to provide some subjective data, but only the patient will be able to give subjective information about the shortness of breath.